Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. We're going to get some massage therapy lessons today. And our guest today is Tiffany Nesfield, and she is a personal trainer and a massage therapist, all in one.
Yes.
And we're going to talk about things that you can do to make you feel better. If you're training hard, you also need to do things to help you recover. Is that as important as the recovery? Is the training as important as the recovery?
They're both important. I feel like a lot of times people focus on the training and forget the recovery. And then a lot of times they train and they get injured and they stop training because they're injured. And so people would realize that if we work our body, that we need to let it recover, and what are the self-recovery tools that we can do on a daily basis to help us train and get stronger. But if we just focus on, oh, I'm weak, I want to get strong, I want to do these things, we have to realize our body takes time to recover, to get better, to get stronger. We break our bodies down so that they can get stronger. And if we don't help facilitate the rebuilding, then we're going to continue to break it down until we cause injury.
Tiffany, you were a Division I athlete. That's how you started off with all of the personal training and that stuff. Tell us a little bit about your background.
Yeah, so I ran track at University of Illinois. And from there, I kind of knew from an early age that I wanted to get into fitness. In high school, I researched at a physical therapy department at Walter Reed, our medical center. And through that kind of changed my route of saying, I want to do something I love. And I've been running track since I was 9 years old, and realized the importance through physical therapy that people train really hard, then they get injured, they go see a physical therapist, they go back, they get injured, they go see a physical therapist, they see a doctor, and then there's this kind of disconnect between all the therapists and the professionals, and I wanted to bring that together, and I want to be a part of the process of people getting stronger, but also doing it in a healthy way. And so being an athlete allowed me to, I've been on the other side of training really hard and understanding the importance of recovering. And so that kind of gave me the basis of wanting to also get into massage therapy, because as a trainer, I realized people weren't taking extra steps to recover or go see the massage therapist when they needed to, or I recommended. So I decided maybe I'll become the massage therapist too.
What is one of the most common issues that people have, people who come to see you for massage therapy? What are they saying? What are you hearing?
A lot of things, but what's really common is people sit at a desk. We sit every day. We wake up, we eat, we get in our cars, we sit at our desk. And so a lot of the common issues is upper cross syndrome. So their back, their neck, their shoulders are really tight. We live in a stressful time, we do this and bring our shoulders up to our ears and our backs. That's the biggest thing. We have certain centers that are just to help people fix their back. And that comes with posture and part of sitting. And so those are the most common things that come in. And there's certain things that are just irregular I check for. And a lot of times it's that. It could be something different. But those are the most common things that people come in.
Now, a lot of times people will think that they're having back pain or that this issue generates from the lower back. And sometimes what hurts isn't the root cause.
Yeah, so I tell everyone that in the beginning. I'm like, what hurts? But then I do an assessment. I want to see how your body looks, a postural assessment, see how you're walking. There's a few different assessments I can do based off the pain you're having. But I look at that and then say, what can be actually causing this pain? A lot of times the area that is in pain is the victim, and it's maybe overworking or something else is not working, and it's screaming, saying to you, hello, something's wrong, you're not doing something right, and now I'm in pain. And it's a compensation a lot of times. And so I'm looking to find what else is the issue. And a lot of times for back pain, it may be your hip flexors, and that's on the front of your spine. But hip flexors being tight from sitting can cause you to be forward a little bit and those back muscles to strain, and that's where the pain comes from. Not always, but a lot of times it is. And so I'm looking for that. What else could be the issue?
You do a special type of procedure with the muscles. Yeah. So can we talk about that?
Yeah, so I'm an ART provider. That's active release technique. So people come to me and it's not a normal massage, it's more therapeutic. A lot of chiropractors, physical therapists do it as well. And they come in, you come in dressed as you are, maybe a sports bra and shorts, and I'm going to take your muscle through a shortened range to a long, extended range and release that muscle, tendon, ligament. And it can be used for a lot of different things. People who have carpal tunnel. I like to be like they say the first responder. Before you go see the doctor or after you see the doctor, before you decide, hey, I need surgery or do my knees or any knee replacement, let's figure out if it's a muscle thing. And I feel like a lot of times it's muscle and tendons that are tight, and we neglect our body for so long that we wait till it's really bad and we're like, oh no, I'm gonna need to go see the doctor and have surgery. And that may be the case, but before we get there, let's do some therapeutic things with the body, the muscles, the ligaments, to figure out if we can, from that standpoint, relieve the pain and get you moving better.
And how exactly does that work? What do you do to the muscles to open them up or to stretch them?
Yeah, so what happened is overuse injuries. We do things repetitive over and over again, and those muscles get tight. There's lactic acid that builds up. There's this thing called myofascia that's in our body, the fascia we do, and it gets tight, and then it gets adhesions. And from lack of movement or just overuse, I need to go and break up that tissue, those ligaments, that fascia, so that you can move. It's not always the best feeling thing. It may be slightly painful, but a lot of times we're already in pain. And I want to release that so that you can move. There's just restrictions in our body, and we need to get rid of that restriction. Our body is made to move, and once we stop allowing it to do that, that's when we feel these issues in our body, and we feel tension, and we feel pain. If we can create more movement, that's where we take the pain out.
Now, there are different types of massage, of course.
Yes.
You've got your Swedish massage or Thai massage. What you're doing is a massage, but it's different.
Yeah, I like to say I'm doing body work. Active release technique is a different type. We have deep tissue, we have sports massage that does more stretching. You do have the Swedish and Thai, there's craniosacral. So it depends on what you're coming for. A lot of times I'm looking at stretching those muscles, lengthening them, and making sure they're loose, finding there's compensations in our body, and I give homework. So I like the clients to come to me. I call myself on the big guns. I'll come in and really work you out, things that you're not going to put yourself in that discomfort. And I'm going to do that, and I'm going to say, hey, here's the homework you need to do before you come see me again. Maybe homework you can do so that you don't have to come back and see me. And so we're looking at preventative care than just coming in for a massage to work on those issues. But can we stop the pain from reoccurring? And it may not happen right away. I think a lot of times clients come in and they expect to leave and I'm going to be healed. And there's times where they're like, oh, is this magic? Sometimes they've been in pain for a long time and they leave with less pain. They're like, this is crazy. But it's not. I wish I could say as a musician, it's not. It's just the body working and releasing itself and getting itself out of pain.
If a person is exercising, they're trying to get on a new plan or whatever, they're exercising 3 or 4 times a week.
Yeah.
What should the healing process do? If you do a hard workout, should you heal for a day? Let's talk about the fact that when you exercise, when you do a hard workout, there some tears happen to the muscles.
Yeah, so when you work out, you're going to get muscle tears within the muscle. That's to help get stronger. You need to have muscle tears. It means you're working out hard enough. You don't want to have it so much that you're so sore and you can't move the next day, but you may feel some discomfort. But immediately after a workout, you should stretch. So that helps the lactic acid, the tears, to kind of release back into the bloodstream so that you are feeling less of the onset muscle soreness the next day. That helps. If we're not stretching, then our muscles are getting tight. And so the next time we work out, they're going to get tighter again and then tighter. And that's where we're looking to get injured. But if we can kind of have that process, that circle of I'm going to work out, I'm going to stretch, I'm going to foam roll, recover, and then work out again, and then keep that cycle so that I can keep on getting stronger, but in a healthy, safe way. That's most important, is that if you're going to train, you're going to start a new program, that you do it in a safe manner so that you can continue to get stronger.
We're going to talk a little bit more about the foam rolling, or we're going to give a demonstration on foam rolling a little bit later on. But how should you incorporate that into your workout program? Should you roll every day? Should you roll once a week? Should you roll once a month?
I would love people to roll every day. I say, but it's a process. With every habit, we have to create it and we have to start slow. If you are working out, you should foam roll. So the day you work out, make sure that you foam roll before or after. I like to do it after, but sometimes the older we get, the more tired we are. If you're coming from sitting at a desk, you have to realize you have to warm up. So foam rolling before can really help loosen those muscles so that when you first start moving, you're not kind of feeling achy. It can help take that ache away. and then after to reset the muscles so that you can go back and you're not sitting at your desk and then everything's getting tight again. So a rule of thumb, if you work out, make sure you foam roll. And once you get that, then if you can, do it on a daily basis, especially the areas that may be tight. You don't have to foam your whole body, but there's certain areas that you may get tight from being at work. It'd be a great thing to foam roll your back or your arms to kind of help them stay relaxed and released.
You just mentioned that you should stretch after each workout. That's been a debate for as long as I can remember. Should you stretch before or should you stretch after? What should you do before, or it's just not important to stretch before?
Oh, it's really important to do something before, but stretching may not be the only thing or the most important thing. It's more of a dynamic warm-up. You want to get your body ready to move. So that's moving through a movement. So it's not static. There's a dynamic stretch and there's a static stretch. So dynamic is you're going to continue not holding the position for more than 3 to 5 seconds, and you're continually moving. So you're getting that blood flowing, getting your body say, hey, I've been sitting for a while, or I've been not doing much, and now I'm ready to move. How do I prepare my body to move? The static stretching is after. Now I'm bringing my body back to rest. I want to make sure that these muscles are lengthened back to their normal state so that they're not staying in that contracted state. And it's really important. And that's why I like also to do the foam rolling. We realize there's this thing, our fascial system, which is really important, maybe more important than our muscle system, because it encompasses our entire muscles, and it's that layer right underneath our skin.
Now, not to get too technical about the fascia, but what exactly is that?
Yes. So this is what I like to explain in layman's terms. Everyone has seen a raw piece of chicken. All right?
Yes.
Okay. So you have the skin, and then you have this little white film underneath the skin that you see. That's our fascia. But then if you also see the meat of the leg, you also see little white striations within it. That's also your fascia. Your fascia connects everything. And so what happens is that if that fascia hardens, you can get areas that are stuck within the skin and also within the muscle. So my thing is, if I release that fascia, it also allows the muscle to move freely because that fascia encompasses the entire muscle. So that's why you hear about fascia and foam rolling and how important it is, because researchers are finding out that releasing the fascia is going to help restrictions in our body.
And what about the people say, I don't know how?
It is. So it can be tough for some, but it's really easy. There's so many YouTube videos, but there is a right way and a wrong way to roll out.
Because if you're doing it wrong.
Yeah, because there's a lot of times where I ask people, are you rolling? They're like, yes. And I'm like, are you rolling? And if they're not rolling long enough, we're a quick society. Everything has to be right away and done.
Fast
and if I had a pill for
yes.
everything, I would be a really rich woman and just like, hey, take a pill and be loose. But that's not the case. And it's taken a while for our bodies to get tight, so it's going to take a little time for us to release. And rolling is not actually rolling back and forth quickly. It's finding that spot that maybe had discomfort and staying there for about 30 seconds, maybe sometimes a little bit longer to feel that muscle release. You will feel the fascia kind of unravel within you, and then you roll to the next spot. So I feel like the rolling part is to roll to the next spot that's tight, not to roll back and forth really quickly, because our fascia takes a little while to respond. And if say we're going to roll our quads out, and we do it really quickly back and forth, we're not getting the results that we need. So I want to teach you how to do it properly so that when you are rolling, you're getting a benefit. There's no point of wasting your time, even if it's 5 minutes, if you're doing it incorrectly.
And you said something earlier that you don't have to roll the whole body at one time, because nobody has time to do everything.
I know. I would be there for an hour if I was rolling my whole body. What I like to do with all my clients when I first meet them is teach them how to roll, but then go through each section, and then what are the areas that are really tight? What are the areas that are bothering you? Those are your go-to areas. So, and then every once in a while, check in with those other areas if they're tight. So I'm going to release my calves. But if you know that your shoulders are really tight, your back's really tight, and maybe your quads, those are the 3 areas that you're going to always roll out.
Okay, let's say that again. Your
back, maybe your shoulders, and your quads. It could be your glutes. It depends on you. It depends on what you do and what areas. We'll show you a few different ones, but it literally depends on each person. My calves may be tight. But for you, maybe they're not tight. Maybe it's your back, maybe it's your lats. So you have to kind of do a scan and know your body and then say, hey, this is what I need to do every time. And then I may be feeling restrictions in my body, feeling tight, then I may add a different body part. I may do, one day I'm doing upper body, I'm gonna roll out my upper body, and next time I'm gonna roll my lower body. Find out what's right for you. There's no right or wrong way when mixing it up, but it's what's right for you.
And let's talk about how often you should receive a therapeutic massage.
Okay.
Should you receive, now you've worked with athletes
Yes, yes.
before, so I'm sure they get them more regularly.
Yeah.
But the normal person like me who works out 3 or 4 times a week, who does yoga every day, how often should I see someone like you?
So a rule of thumb, I recommend once a month. But also, it's really personal. Massage is personal as well, like knowing how much self-care are you doing. So I can do a massage and I may give you some homework or things you should work on. If you're not doing it as often, you may need to do it more. Or maybe you're the weekend warrior, you're training for a marathon, you're working out 5-6 times a week, and you're realizing you're not able to upkeep with the self-care, then maybe it's twice a month. It has to do once a week, but it depends on you. At least once a month, and then figure out how long it takes you to get to the point where you're like, I can't release myself. My body feels a little bit tight and I need some extra help. For you, maybe 3 weeks, and maybe 4 weeks. Maybe it's every 6, but it depends on your body. Some people are naturally more tight. Some people are over flexible, they're hypermobile. And so a lot of times they may not need a massage, they may need to strengthen their body and limit some of their mobility and their range of motion. And so maybe certain areas may be tight where it's like a 30-minute, I need to work on certain parts of my body. So it really depends on you, but a rule of thumb is once a month.
Let's talk about post-massage. How much water should you drink, or why is it important to drink water after a massage?
So what I'm doing, if you're coming to me, a lot of times you have adhesions, that's lactic acid buildup, and I'm releasing that into your bloodstream. And I want you to flush it out. Because a lot of times people may get a massage and they're like, oh, it was really painful, and after the next day, they feel like icky. And I wanted that icky is because you're probably dehydrated and you got a massage, you release that lactic acid, now it's sitting within your muscles and you didn't flush it out. So it depends also how well you do of hydrating yourself. If you're drinking enough water on a regular basis, maybe just an extra glass or 2. If you don't drink water regularly and you're already dehydrated, I would make sure you drink maybe 4 or 5 glasses of water because you're probably also trying to catch up. Our body's made of water and it needs to be flushed out and things need to be moving well. And during a massage, what I'm doing is moving things through. And what people don't also realize is that they come hydrated. Your massage will feel different if you're not hydrated compared to being hydrated.
Really?
Yeah. So that's another thing. Is like I've had people who come regularly and are like, oh, this felt really hard today compared to other times. And I can tell the massage therapist when I'm working through your muscles if you're hydrated or not. It's easier for me to work through the muscles, or I feel like they're really stuck because your body needs water. Your body's made of water, and those muscles, there's fluid that goes through it. And if you're dehydrated, there's less fluid for me to work with to release the lactic acid. And so it's just not gonna feel as comfortable. And so it's better to make sure you go to your massage hydrated as well as hydrating afterwards.
You know that I've never heard anybody say that.
Yeah.
I have never heard anybody. That is good information. Yeah. That before you go in for that massage, you definitely need to be hydrated. We'll also talk about, we're going to take a break, and then when we come back, we're going to have you do an example of the foam rolling. What difference does vibration make when you are trying to purchase a roller or something that works that? Why vibrate? Why not vibrate?
So the new kick is the vibrating foam rollers. I'm a believer. I love it. Most of my clients now have it because I use it on them and they see such a difference. A lot of times, like it resets our system. I work with clients that say, hey, relax. And they're like, I am relaxed. And they're like, I'm like, if I let go of your arm, it should fall. And it's like, So it confuses. It lets the muscle to contract, relax. There's also a stretching technique. We contract the muscle and then relax, and we get a deeper stretch. And so that's what it's continually doing over and over again to help the muscle release. And so I also think it's a little less painful when you are doing that, so you can relax. Because if you can't relax while you're stretching or foam rolling, you're going to be fighting yourself to release. And so You want to have a little bit of discomfort, but not too much where you're clenching and, you know, gritting your teeth that this hurts too much.
And I'm sure when you're doing a therapeutic massage, you come across people who are like this, and you probably need to take time to bring them down.
Yeah, so breathing through is really important. I realized that people, if they breathe through stretches, breathe through a massage. Also, I'm not looking to kill them during their massage, maybe deep tissue, but I'm never wanting to be at a 10 for someone.
What does that mean to breathe through?
Breathe through. So a lot, if you do yoga, and a lot of times breathing, work on your breathing, it allows you to relax because it takes your focus off what's going on, but it brings that internal breath, it brings oxygen to your muscles.
So you should breathe into the muscle or focus on another part of your body?
So I like to breathe into the muscle because you're focusing on it to relax. Some people, it may be simple as just breathing and calming their mind and kind of going somewhere else. Take a deep breath in, make sure they're opening their lungs, because we hold a lot of tension. I tell people that even outside of that, when it comes to massage, and say, some of the homework is go home, lay down, do your yoga pose at the end where you lay and just let your body go dead. You need to do that. You need to let your body relax, because we are like this all the time. We're moving and we don't relax our muscles. And our muscles are supposed to contract and relax. And if we don't allow them to relax, that's where the adhesions come. So I say go home, take deep breaths, learn how to breathe through your diaphragm so that you're getting oxygen to those muscles.
Because
and
we breathe
in. Yes, we breathe. Yes, we're chest breathers, and that's why everyone's tight here and here, because they use those muscles so often.
Well, what we're going to do, Tiffany, we're going to take a little bit of a break, and then when we come back, you are going to demonstrate rolling. Something that we should be doing you should roll.
Yes,
on
roll.
a regular.
Roll, please roll.
So we're going to demonstrate rolling. You're watching the Sisters for Fitness Wellness Show. I'm Tiffany Gaines-Bryant. We're talking to therapeutic massage therapist.
Yes.
Yes, massage therapist Tiffany Nesfield. We'll be right back.
Your girls have been with you through every moment of your life. They were with you when you felt unbreakable, and with you when you had your heart broken. They were with you when you shared your love with the world, and with you when she became your world. They're still with you right now. But how well do you know them?
Hello and welcome back to the Sisters for Fitness Wellness Show. I'm Tiffany Gaines-Bryant. Our guest today is Tiffany Nesfield, and she is a massage therapist. We're going to go over a few techniques and how to rock and roll, or just roll,
yes,
per se. So explain to us, take a minute to explain exactly what do we have here.
All right, so first we have the foam roller. This one's a little bit different. It has ridges in it. So if you've been foam rolling for a while, you want some little extra care, you can have some little ridges to get a little bit deeper. We have some new tools here that vibrate. So we have the foam roller that vibrates. It's 3 different settings, and they go from lighter to more vibration. Within the same company, Hyperice, they have a ball. And so those are for the certain areas that need to be a little bit deeper than you would get with a regular foam roller. I like these 2. These are called peanuts. This is a regular one for use for your spine, down along your spine, which tend to be tight. And then we have a vibrating peanut. So you can use for the same thing, and you can use for different parts of your body.
Okay, so let's do some examples of rolling.
Okay, so let's start with your back.
Okay.
I'm going to give you this foam roller.
Okay.
You're going to start by laying on your back in a bridge.
Okay.
And then you're going to put the foam roller on your middle upper back.
Okay.
So this is really important to get your thoracic spine. From here, you're going to put your hands behind your neck just for support.
Okay.
And you're going to lift your glutes off the ground. And you're going to find a spot that feels discomfort. From here, this is where the rolling takes part. You're going to roll back and forth until you find an area that may be tight. Maybe it's just a general tightness, then you can just roll slowly.
Okay.
When you find a spot, you can stay there. You can drop your hips down. And then we can open up your thoracic spine by opening the chest and dropping the head down.
Ooh, that feels
Yes.
great.
So your thoracic spine should be mobile. So it's really important. We get really stuck here. So here you can move an inch up or down and repeat. And really try to open the chest.
Very good.
Good.
Well, let's move on to the next body part.
All right, so take that foam roller and place it underneath your legs.
Okay.
From here, you're gonna get back into a bridge position.
All right.
You're gonna lift your hips up and put the roller right underneath your hips, closer to your sacrum.
Okay. And the sacrum is the lower
back. Yes, the very tail end of your spine. And you can stay here. If you need more, you can lift one leg up at a time to get deeper into one side.
Okay.
And then you can switch and try the other side. And if you want more, then you can put both legs towards your chest.
Okay.
And release here, trying to open up that lower spine. And you can play with it as moving a little bit further up your spine to open up.
Okay. So roll a little bit forward.
Forward,
yeah.
and then really feel it. You want to find the area that's tight. If it feels loose, then just move it up about a centimeter or inch to figure out what's that area for you that may be holding tension.
I found my spot. Well, let's move on to the next one.
Okay, great. So the next thing, I'm going to hand you the vibrating ball. I'm actually going to put this one on for you.
Okay.
So it's this vibration right here. You can feel it. There's 3 different settings. I'm going to use the roller 2 example.
Okay.
So you're going to sit on the ball on one glute at a time. So you're going to sit.
So one cheek at a time.
One cheek at a time, and kind of lean to that side.
Okay.
And then you're going to roll around till you find an area that you feel that's tight or discomfort. Once you find that, you're going to stay there and probably stay there for 30 seconds before you move on to another spot.
Okay.
And you can, to apply a little more pressure, you can lift one leg up and then go deeper in and try to figure out what area that's really tight to release. You feel that?
I love it.
Everyone does. So I really love the vibrating rollers.
Okay, let me just do the other.
The other side, I know. There you go. You got to be even.
Yeah. Oh, that's wonderful. I could sit here for a while.
That's what my clients do. They're like, could we stay here and roll the whole hour? I'm like, no. All right, so I'm going to hand you the roller one more time.
Okay.
I'm going to take this off. Okay, we're going to get into a plank position.
Okay.
All right, so you're going to put the roller, you're in your quads right there.
Okay.
And then come down onto your elbows. When you're here, you're going to roll forward or back to find the area that's tight. Once you find that spot, it may be closer to your knees, closer to your hips. You're going to find there and just stay right there.
Oh, that's
and you're gonna
good.
really, and
unfortunately, we're going to have to wrap it up, but this is a good place to wrap it up. Yes. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today, Tiffany Nesfield, a massage therapist. Thank you so much for joining us, and roll it every day if you can. Have a great day.
take care.